myeloma is actually a very relatively uncommon cancer. It's considered to be a form of a hematological malignancy, meaning it's a kind of a blood cancer, and are primarily treated by hematologists and medical oncologists. Multiple myeloma specifically is a cancer of plasma cells. Now, what exactly are plasma cells? There are white blood cells and red blood cells and platelets in all of our blood. There are kinds of white blood cells called B and T lymphocytes, which are very critical to our immune system. And the B lymphocytes are very important in facing infections and reacting to it. So when B lymphocytes actually respond to an infection, they mature and they learn to produce antibodies. And in this maturation process, they turn into what we call plasma cells. These plasma cells make specific antibodies, which are also called as immunoglobulins, against the infectious agent they encountered. Normal plasma cells are usually found mainly in the bone marrow and also sometimes in the peripheral blood, and they are very important parts of the immune system. And again, multiple myeloma is an abnormal state in which plasma cells multiply uncontrollably. According to the American Cancer Society statistics for 2023, in the United States, the lifetime risk of developing multiple myeloma is 1 out of 132 people, which is like less than 0.76%. The vast majority of cases are expected to occur in patients more than 65 years of age, and 50% of those patients diagnosed with multiple myeloma are expected to live beyond 5 years after diagnosis. An estimated 130,000 of patients in America, in United States, are currently living with multiple myeloma, with estimates pointing to as high as 30,000 new cases being diagnosed each year in the United States. So just taking a step back and going back into basics, like what exactly is a plasma cell and what exactly are all these antibodies we keep talking about? So I alluded to what a plasma cell was before. It's a B cell that has become mature and it produces antibody. The diagrammatic depiction of an antibody is what I've shown on the right side. You know, that Y-shaped symbol is like how we represent antibodies. It has what we call a light chain component and a heavy chain component. The light chains can be either a kappa or a lambda, like the Greek symbols, and the heavy chain can be immunoglobulin or IgG, E, D, M, and A. So these are the 5 kinds of heavy chains that comprise the immunoglobulin molecule. Plasma cells can produce sort of any type of antibody or just light chains by itself. And plasma cells are present in a normal bone marrow. However, in multiple myeloma, there is an overgrowth of plasma cells in the bone marrow, which can crowd out normal cells and can cause very low blood counts in those affected with myeloma. So because our body faces multiple different kinds of infections, you can imagine there are multiple different types of plasma cells that produce all kinds of antibodies. And that's the normal state in the body, meaning there are polyclonal, meaning multiple different types of plasma cells producing polyclonal antibodies, meaning multiple different types of antibodies. Multiple myeloma, on the other hand, is when one particular kind of plasma cell multiplies uncontrollably, resulting in an overproduction of one single type of antibody, which is called a monoclonal antibody. And these monoclonal antibodies, again, will only have either kappa or lambda light chain. So in the myeloma bone marrow, sometimes these plasma cells and healthy B cells can undergo DNA damage, and these damaged cells transform into plasma cells, generating a lot of M proteins. So that's how how multiple myeloma comes into being. There are risk factors that are thought to be, genetic in nature, environmental in nature. However, a clear association is yet to be charted out.